Hello and welcome. I'm Sophie Tomer Cruz, and today we are joined by important guests. It's the 6th month since the pandemic started and since lockdown restrictions were first imposed in the country. So, joining us today are representatives from the Healthcare Professionals Alliance Against COVID-19, or HPAC, and they represent the country's doctors, nurses, midwives, and other allied health professionals. They're the largest coalition of health workers in the country, and if we recall, they did a service to us a few weeks ago when they warned us about the status of the country's pandemic response and what we need to do to fix that and strengthen it going forward. So joining us today is Dr. Maalidin Biruwar, who is the Secretary of the Philippine Society of Nephrology. Thank you for joining us today, Doctor. And also with Dr. Biruwar is Dr. Pauline Convocar, who is the President of the Philippine College of Emergency Medicine, and Dr. Lei Camiling Alfonso, who is a technical specialist for the Philippine Society of Public Health Physicians. Thank you for joining us today. So, just to start off the discussion, it's been 6 months since the pandemic was declared and the Philippines implemented lockdown restrictions. We topped over 250,000 cases already and have counted more than 4,000 deaths. And I wanted to ask you, doctors, what do you make of where we are in our fight against the pandemic versus where you maybe hope we would have been 6 months ago at this point? Siguro, Dr. Lee. Um,
Right. So where are we? Hi, thank you for the question, Sophia. So the question is, where are we now in the fight against this pandemic after 6 months? And there are so many layers to that question. And perhaps one of the things that we can provide right now is in terms of the health response, we can give you inputs on that. But not only that, HPAC has also been working on multiple streams in actually having facilitating a whole of society approach in terms of moving forward with the response. So first, perhaps in terms of our health response, we have seen that at the start, as all countries have experienced, nobody has been in this situation, and no country was ever prepared for this. And those were, in a way, expected. But I believe that there have been progress, especially since after time out, in terms of facilitating different dialogues with different stakeholders, different actors that are involved in the health response to be able to come up with a more united strategy so that we can all fight in a synchronous manner. So I think in terms of the response itself, it's not yet perfect, but we think that much progress has been made. The government has been working hard. The civil societies have been working hard, and I know that each family are coping. But then, the response in terms of progress has been there has been progress made, but we can still do so much more.
so, Dr. Leno, you talked about areas where we can still improve. Um, Now that there's a lot that we know about the virus now that we didn't know 6 months ago, and at the same time, we've also been able to adjust the response and improve it in other areas. But before we get into all of that, you mentioned, right, that there are things that we can improve on. What are some of these things and that we should be paying attention to and trying to improve?
Right. That's actually what we have been pointing out even since the start of the timeout. What are the things we need to improve, and we can elaborate on this later. Is the coordination mechanism from when a patient comes in to the COVID response itself, whether it's an inquiry about the symptom, inquiry on when or where to have a swab test, what to do if you suspect yourself or a family member to have a COVID. So we can still improve on that coordination mechanism. That does not necessarily mean you'll be hospitalized, right? And the second thing is we need to improve a lot more in terms of coordinating the different health facilities so that we don't get overwhelmed in some, while some remain that there are vacancies, or so also we need to coordinate well so that the cases of COVID will not be lost, and they will not hamper also the access to care to non-COVID cases. We can discuss this further with
Mhm,
Dr. Pulido. Yes.
mhm, mhm. Right. On that note, then, one thing that was a big circumstance for you to issue for the group to have called for that timeout a few weeks ago was the reality that a lot of our hospitals were being flooded with the surge in cases and
Yeah.
patients coming for treatment, seeking treatment. You all see what's happening on the ground right now. Can you tell us what it's like?
Okay, so adding on to what Lay has said, I think coming from a perspective of an emergency physician, so we're the discipline of, we are a branch of medicine that receives really patients for acute and emergency care. So kami yung unang-unang tumatanggap talaga ng dagsa ng pasyente. So through this period of from the time of the timeout, that we called for a timeout, and then having prepared for the potential influx again of patients coming from that short period of quote unquote rest, naghahanda yung mga ospital para sa additional na influx. And we have to admit that there was indeed this decreasing trend of patients, the number at least. However, we have also observed that despite the decreasing number, we have also still we are still seeing patients that are still critical and emergent and who have not had access of care from the community to another facility, and so they do hospital hopping, and that is not this leads to poor outcomes for the patient. So currently bed capacity is still at warning levels, and we have to understand that beds are not just numbers. We also have to account for the capacity to manage those patients. So, if I may discuss that emergency level or warning level and emergency level is different from that of the disaster level. So when you say disaster level, or we are already in a state of disaster, that's when we say that we are beyond our capacity to respond. So currently we are in the response phase, and even in this response phase, we're still preparing for a potential disaster if these capacities are overwhelmed. So kasi sa ngayon, the numbers may be decreasing, but the severity and the severity of the cases that we see are still there. And this is really these are really resource intensive. So we consume resources, we utilize health human resource, and we all know that another issue here is that of the healthcare workers getting sick, healthcare workers being exposed, and that they need to be quarantined. So it's not just a simple mathematical equation that 1:1, there's a patient and there's a bed. You have to also understand so many other factors that interplay for the capacity or for the effectiveness of the healthcare system to respond to that case.
Right now, Dr. Pauline. Is that also the case that you see in different hospitals in your experience, Dr. Birawar and Dr. Lay? Are you also still seeing that steady influx of patients, or have you experienced and witnessed some, at least some relief, and that room to really still increase capacity? Of course, taking into account the health workers and the limited number.
Okay. Well, in our experience, because I'm connected with a government hospital, there's still a lot of patients in our emergency room, and we still cannot accommodate everyone who is coming. But in terms of the load, it's true what they said that after the MECQ, there's a lightening of the number of patients that are coming in the emergency room, but still the capacity is not 100%. So we still need more rooms, more beds, and more health workers to take care of these patients. I think also what we need to look at are diseases that are not related to the COVID-19 pandemic, because most of the resources are now being focused on patients who have COVID-19. But what about those patients, for example, who have also chronic diseases that they need to be taken care of? So, for example, patients with hypertension, or patients with cancer, or patients with chronic kidney disease, you cannot just ask people to stay at home, because these patients also need to see their doctors. So we also need to increase our capacity for seeing these patients. For example, in terms of telemedicine. So that is something that we need to enhance. But what about those patients who are not able to consult because they don't have internet access? What about those poor people who don't own a cell phone? So how do they get seen by doctors? Syempre, if they don't know what to do or where to go, they're going to flock to the hospitals. So I think we need to strengthen also primary care.
Right. And on that note, then, I want to ask you, where do you understand we are right now? Sorry, you wanted to add something, Dr. Day?
Yes, Sophia, if it's okay, because he mentioned primary care already, and
Of
I
course.
wanted to do that. When we say, where are we now in the response? One of the things that we need to realize is that the hospital is the last line of defense. So the fact that we are seeing still a lot of patients, critically ill patients in the hospitals, it's just the tip of the iceberg, because 90% of the cases for COVID, data shows it's expected to be mild. Many of them will be, well, really just parang mild talaga na some would just feel malay or anosmia, and they're really walking patients. And this one, it means that if we're seeing a lot of patients in the hospitals, we have not been doing well yet in the preventive aspect. So the prevention part, breaking the chain of transmission, is something that we need to address still in terms of moving forward, because yes, the hospital is the last line of defense. The first line really is first the people, how people behave, right? And then secondly, how we stop the transmission when a person, say, is at the workplace, when the person now goes in a transportation, in a vehicle, or when a person now meets other the social circles that they have. No, so these are the things that we still need to work on, from the shift from the curative side, and now shifting it to the preventive side in primary healthcare at the community level. So there,
Right.
over.
Right. On that note as well, taking all these things that you see in the hospitals, where, as you mentioned, is the last line of defense, and so that's one way we know whether or not our responses on the preventive side might be working. Um, Also, taking from your understanding of where we are right now in the pandemic, I'd like to ask you, because there's been news, of course, recently about whether or not we flatten the curve or we're controlling
Mm.
it, and whether or not cases are really decreasing and on the downward trend. Where do you understand we are right now in the pandemic? Have we peaked? Are we turning a corner? Where are we on in terms of that curve?
Personally, if I may say, I don't want to pretend that I am an epidemiologist, and I don't want to pretend that I'm an expert in this. What I can just say are observations based from my own personal experience as a clinician. So I may not be the best person to analyze this data and give you information on that. If we really do have a decreasing trend, if we're really doing the flattening of the curve, I leave the experts to that, because I don't wanna pretend understanding all of these analytics. Although as a doctor, of course, we do have to be abreast about latest updates about how really are we faring with regards to our battle against this pandemic. However, as a clinician, I do understand that different people have different perspectives as well as to how we really are faring. So we have to also understand the context that some of these are just numbers, but we also have to understand that there is really a social aspect to this, there's an emotional aspect to this, a psychological aspect to this, and these are not measurable. So if it's just a question on how are we faring against this fight, um, people may just give you answers as to numbers, but there is really a big impact out there. with regards how COVID affects us that currently are not put on paper or not even probably studied well and made public. So I'm coming from a perspective of those healthcare workers who are also getting sick. What are the impact, psychologically, physiologically, and all those patients also who have been returning to work? What's the impact to them? What's the impact to the family? So I think we have to look farther than just the numbers to say that's just the measure or just the indicator for how we are faring.
Yeah, thank you. Thank you for raising that important point because I think one thing that and I agree one thing that's often overlooked is, beyond the numbers,
Mm.
how people are coping with the pandemic because it's been 6 months. It might not sound like a long period of time, but of course, under the certain circumstances we have right now, it's taking a toll, of course, on everyone.
Yes, Sophia, before we leave the topic of flattening the
Mm.
curve, one of the things we're saying is that we can never have zero cases. Before we see municipalities, because we work with different municipalities, and we see them still post on their social media, zero COVID case. Or sometimes it also leads to shaming of people who have been known to be positive because the goal, let's be clear, is not to have zero cases. COVID is here. We're not going to graduate, and it will not magically disappear. And even if there will be a vaccine soon, which of course that's another story, we will still have to cope with the presence of COVID. And the thing is, when we talk of flattening the curve, we want to shift the mindset that it's more than just flattening the curve, but learning how to deal with it,
Mm.
as many countries still are doing. And even if initially they have been successful in bringing down, the question now is how do you dance with it? So
Mm.
it's not flattening the curve, but hammering it and then dancing
Mhm.
with it, and
Mhm.
having some safety nets in terms of when do we actually declare a localized lockdown?
Mm-hmm.
How do we balance this with not just economic activity, but the usual
Mm.
activities we have as normal families, right? Because there are so many people who are affected by this, and how do we actually prepare for it? I think that's the most important thing. It's not just about zero cases, flattening the curve, but how do we make our environments, our circles of influence, COVID ready? How is your condominium? Is your condominium community ready if ever there will be a case? Because it's just a matter of time. How is your workplace? Is your workplace COVID ready? How is your own family unit, right? Do you have preparations in place so you know who to call to? So it's really about being COVID ready.
Yeah.
Thank you.
Right. Right. And on that note, no, when we talk about preparedness and being ready, because the pandemic isn't ending anytime soon.
Mm.
I'd also like to ask you all about new developments that have taken place recently. We see us looking at, for example, antigen tests, which might help our testing capacity, and then we also have measures like reducing the physical distance between commuters and public transport. What do you make of these decisions taking place? Because I think one thing that's still present right now is at least that sort of mindset where people are thinking, economy or health. But what do you make of this, and how do we overcome that kind of thinking?
Well, for our rapid antigen testing, it really has a lot of promise because it is point of care testing. And in 15 minutes, you can get the result. But if you look at the website of the Philippine Society of Microbiology and Infectious Diseases, or the TISMID, and also in CDC, or Centers for Disease Control in America, they're still not recommending it as a diagnostic tool. We need to do more studies on it because the studies that were available is that it has low sensitivity, lower than RT-PCR. So which means that there are more false negatives. So of course we don't want that a lot of people are deemed to be not having COVID-19 when actually they do have it, and that's what we call as asymptomatic transmission of the disease, no? Because they were falsely diagnosed to not have it. So currently it's being studied, and I think it's being considered for that purpose, but we still need to wait for the results of these studies before we can say that it can be adopted as a diagnostic tool for COVID-19. But it has its uses, and we need to defer to our experts in the field of infectious disease to tell us where to use it and then how to use it. Again, because there are also other tests available. So may gamit naman yung lahat, may tamang paraan at tamang panahon. So we need to defer to our infectious disease specialists for that. Now, regarding the distancing in public utility vehicles or in the transportation, HPAC is still firm on our recommendation that we believe that social distancing is very important even at this point in the pandemic. So we would like to maintain social distancing of at least 1 meter. If you look at the recommendation of DOH, WHO, they recommend 1 to 2 meters, no? But I think we have already adopted the 1 meter. Now, if you look at the DOH recommendation, it's also the same, 1 meter. So, mahirap kasi, no, at this point in time, marami pa ring cases. You were also asking where we are at this point. We are still in the pandemic, no? Hindi pa siya nawawala. There's still a lot of cases. Other people will say, well, because we have increased testing. But that's not the point. If there's no disease, there's no positive result. If you look at the testing in Cebu or the results in Cebu, I think the cases there are going down. And hopefully, hindi na sila magkaroon ulit ng surge, no? So maybe the response is better. I don't know, but we have been affected by the pandemic longer than Cebu, and yet napakataas pa rin ng cases natin, almost 3,000 per day. So meron pa rin. We're still in the middle of it, and yet gusto pa rin natin na mag-decrease yung distancing, no? So paano? I know the economy will have to recover. But it's really difficult din to say without balancing both, because we want to take care of our health, but livelihood is also very important, and economy, no? But as much as possible, syempre, we don't want to sacrifice lives just so we can get what we want in terms of business growth, and hopefully we find a good balance of that. So I think my other colleagues can also say something about the 1 meter distancing.
Right. Dr. Lay or Dr. Pauline, would you like to add to that?
Pauline?
Ako muna. For practical reasons, of course, I will always submit the science. But for practical reasons kasi, we should look into other alternatives than just having the 1 meter distance as an intervention. Kasi baka naman kasi po pwedeng tingnan yung ano bang pwede pang gawin, like increase the number of trips, increase the number of public utility vehicles. So there may be other interventions that would not necessarily make us decrease the distance, just so we may be able to accommodate these commuters. So I'm coming from that perspective of looking into the other interventions. But we do uphold, still in our college also, in support of HPAC, that we do uphold that we have to maintain the 1 meter distance to give a message also out there that we are still we're still in the middle of the pandemic, and it's too early to decrease the distancing as of this point.
Mm-hmm. Dr. Lay, would you like to add anything?
Yes. Yeah. So in terms of the dichotomy, there's really no dichotomy in terms of livelihood and health. How can you have a good livelihood if you're not healthy, diba? I mean, if the father of the house gets sick, then we cannot undo that. And in fact, these are the things that we also consider when we have dialogues with different sectors. So, for example, HPAC has been in dialogue also with the Move as One coalition. We were talking with the GP groups, economists also, and these recommendations have been made with the proper data analysis, not just to model like how its impact will be in terms of the economic impact, but also on the health consequences. We believe that in order to really to have good public policy, these different stakeholders, this different perspective should be kept in balance. It's really not very easy to make these decisions. No? One of the things, for example, that may not be may not be reflected by paper or by any forecast would be the unintended effects of certain policies. So, for example, if we say, all right, we make it say 0.75 meters now, and then next week half a meter, and then let's see how many people will die or how many people will get it. Let's monitor, right? So if people can decide on that, then now others are asking, oh, if we can actually decrease or relax the physical distancing in transportation, then maybe we can also do that in restaurants. Maybe we can also do that in public gatherings, or we can also do that, etc., etc. So it can have unintended effects that may not be covered by those modeling studies. And this, for example, right now in many areas, some of our kababayans think wala na yung virus. So by relaxing, we still don't know at this point. It's still a very delicate situation. We're in, as Dr. Pauline mentioned, we're yet seeing a lot of patients, and we are not yet out of that danger level to be able to dance with this kind of surge of patients if this unintended effects happen.
Stepping back from that a little bit, no. I think one thing kasi that's really taking place, of course, the latest example of it would be the proposal to, well, not really proposal, but kind of policy in some ways already, to reduce the distance between commuters and transport. But behind that, no, stepping back from that, it's really this discussion that's still taking place until now that we're 6 months into the pandemic, about, you know, like other countries, we're trying to open up our economy and revive it, because livelihoods are also important, of course. But there's still that debate about whether or not to prioritize economy or health. I'd like to ask you, you know, you all understand how many things affect a patient. No, it's not just it's not just sickness or like germs or virus. Um, how do we overcome about that dichotomy about health and economy? Because I think that's an important thing to touch on if we're going to really find a sustainable way to keep moving forward.
Can I take a first stab? No, I'm sure they can add also. But this is also why, Sophia, when we make recommendations, we don't make them in silos. In fact, for example, when we recommend these things, like, okay, let's maintain the minimum standard, because anything less than that is technically close contact, right? So if we say that we recommend this minimum standard, then we have also proposals like, let's now make the bike lanes more safe. Let's encourage people now to bike. Let's now encourage people to walk if they can. We also have recommendations like holding activities, or opening up markets with a pedestrianized street. Say you pedestrianize a street and people can come in and they can dine, but they will be in open air. So with proper physical distancing, hindi siksikan sa loob ng isang kulob na restaurant, that protects them and it reduces transmission by 98%. But at the same time, it benefits the businesses. So these recommendations are not made in silo. And for us to be able to move forward with the economy also, then we really need the private sector, the business sector, to work with us, because that is also our intention. Otherwise, the doctors, the medical professionals will just keep on firefighting. And we don't want this, because we're all in this together. For us in HPAC, we're not paid to do this at this point. Nobody is telling us or paying us, oh, this is what you should push. Or nobody is having, our only intention, if you can only hear our members, is just we're staying here because the Filipinos still need us. We don't want our patients to die. We don't want communities to suffer. And we want to care for our colleagues. And we don't want to come to the point wherein we need to choose, and each day that we see that their Facebook posts, they leave their families and they pray before leaving their families. All of this moves us. So please, the business sector, we want to work with you, and
Mhm.
we hope that we can continue the discussion moving forward because yeah, there's really no duality in this. That's all.
Mhm. 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 Right. Right. No. And at the same time, I think you said it perfectly, Dr. Lee. Your group has a lot of solutions that you're offering to not just the public, but people who make decisions like our business owners and at the same time the government. Have you been able to talk to them about this, help consult them on how to move forward? Are they still open to that as they were when you made the call for a timeout and to really reassess our response in August?
Um, I'll answer first. I think there have been a lot of meetings already between HPAC and other government agencies and also the business sector. And siguro I might say that we are working together with them. No, it's hard to say that they are consulting us because we're not really the only experts here. Although we are a formidable group of more than 160 healthcare workers organizations, but we have to work together with each other. And I want to add also to what Lei said. I think another important aspect of the response to the pandemic that we have not been discussing would be communication. So, kasi regardless of whatever policy we discuss, whatever things we find out, if we don't package it properly and tell it to the people who matter, then our strategies will be useless. And who am I talking about? I think I'm talking about the people who are there in the streets, the ones who are really affected by the disease. Because some of us who have access to internet, who can watch TV, who can read the text messages or read Facebook, are the ones who are just safely confined in our homes. But what about those people who have to go out every day because they need to work? They need to earn because they need to buy food, no, on a daily basis. That's why it's really very important that there's a good balance between health and livelihood, and we have to reach out to them. So we have to teach them, capacitate them. That's why I think our response should be LGU led. So which means dapat, no, in the local government unit, like in your barangay or in your city, there's already a system to take care of these concerns from these people, so that nandun na yung first line of response. Kasi nga dapat last line na yung hospital. But what's happening, if people do not know where to go, what to do, then parang nagiging first line of response, they go to the hospital. Hindi naman kaya ng hospital lahat because hopefully yung dapat sana mangyari is that the hospital will only take care of moderate to severe cases. But those who are mild cases or those who don't have COVID-19, dapat na-solve na siya on a local level.
Right now. That's a good point that you raised, no, Doc. Because and I'd like to also ask Dr. Lee and Dr. Pauline about this when we talk about how to move forward. No, we always mention a lot of it has to be led by local governments because that's really how we can prevent the spread. Kasi nga, they're if the hospitals are the last line of defense, they're also in the first line. And so I understand also that the both of you have a lot of experience when it comes to local responses because you were both doctors to the barrios, right? If I'm not mistaken. And so
Yes.
when we look at our local governments and our barangays and communities, what do you see there that we can improve on? And perhaps maybe some advice that you can lend to community leaders.
Lei, may I start, Lei? Okay. Thank you very much for the question, Sophia, because it really resonates with me, the question on our focus before we even entered or we even had this pandemic. So, glaringly, the COVID-19 highlighted some of the vulnerabilities of our healthcare system. That can never be overemphasized. I've been repeating that message every so often, that indeed we have to focus on the primary care aspect, the interfacility transfers, the coordination and the referral network, or what we call in a structure the healthcare provider delivery network. However, there are really still disparities and inequalities that we can see across local government units, because by nature, as a country, as an archipelago, there really are differences as to access. We have to also account for the differences as to the economic capacity of the LGUs. However, wherever you are in the country, we have to understand that care should be standard. Care should still be quality despite these differences. It should still be universal. There should always be access to health. It is a right. So similarly, access to emergency care should also be universal. So for now, it does not happen because of these disparities, because of these inequalities. Um, we are pushing for a unified referral network wherein we have to take into account patient navigation. So this should be patient centered, looking at the situation at the lens of the patient, coming from the homes, the families, to the communities, and then we have to give them a roadmap as to their common questions on where to go, where to be tested, where to seek help for treatment if needed. But what happens is that for now, what happens is that sometimes there are certain situations when the first point of contact may not be the appropriate facility, and that facility needs to be transferred to another facility, which may be more appropriate or which may be more capable of handling the case. And sometimes they're left to tend for themselves. They don't have access to emergency medical services. It's not just about the vehicle itself, but also the healthcare workers should be competent in conducting these patients from point to point. So that's where the hospital hopping happens. That's where we see stories or we see cases where they share that you are the eighth hospital, and it just so happened it's like a lottery that actually I passed by your hospital the first time and you said you were full, but then again there was this vacancy for some reason, even the possibility of a death in the hospital. That's why there was a vacant bed, and so that patient was taken in. So it's crazy difficult to handle cases like this.
For our local governments, maybe it's easy to get overwhelmed by all the demands that this COVID response has brought all of us. But it's good to step back, have a good analysis of the situation, and look where the bottlenecks are, where the priority needs are. When we say priority needs, what really needs to be addressed? What is the bottleneck there? And often there are many options in terms of interventions, but not all interventions are the same. And we know that in a local government, you don't have funds na unlimited. Uh, it's the same thing as when you have a household. You have to budget for how much do we spend for food. So which interventions will be more sulit? No, this is really good. And how do you know how to know that what interventions chosen are sulit is to really ask, are these technologies effective? Because if they're not effective, then it's a waste of time kung gagawin mo itong screening na to, tas uulitin mo lang. So sayang yon. That's not sulit. So this is where where the guidance of the Department of Health comes in. And we also have the Health Technology Assessment Unit in the Department of Health, and this is now helping really say, in terms of standards, ano yung sulit na interventions, na technologies. And then once you've identified the priority interventions, I think one of the things that's very important in this response is whole of society approach, not just whole of government approach. But you know what we found out in COVID, many people want to help. In fact, for us, everyone who's jumped in to help us, donating their time, their expertise. They have been all volunteers, and people rise up for such a time as this. And it's just such an honor to harness those kinds of collaboration between the government, the public sector, civil society, and also the private sector. This is where the consultation happens. It has to happen not just top down, but also horizontally. And this is where everyone can talk. Okay, you need this from the private sector. We have this. Okay, you need this from the volunteers. We have this, and it's about just connecting the dots and seeing all the resources and synergies. And if there are questions, for example, I heard there are some leaders who are not sure because the health technology is very technical. It can get very technical, and the question is who to ask, who to reach out to, and this is where many of them are confused. And I believe this is also the contribution of HPAC, wherein all of us here bring in different lenses, different expertise. Nobody claims expertise monopoly in COVID. For example, I am a public health person, but I am working with Dr. Beruar. He's a nephrologist. We are working with epidemiologists. We are working with data modelers. So there is that whole gamut of collaboration that is happening within HPAC. And in terms of bringing those guidance, we are going to be coming up with the updated, unified clinical practice guidelines so that makikita po doon ano yung sulit. And people don't need to read the thousands and thousands of papers, technical papers, scientific papers that actually assess that. It's very technical. So it's important po that when we assess what intervention should be decided on, consulted with, and who to ask, that we have these vetted information. We don't just leave it up to opinions, or we don't just leave it up to this is what this particular leader thinks should happen. These should be negotiated. So that's it.
Right. And on that note as well, you mentioned that the HPAC is really in this unique position where you get to hear a lot of what's happening in different areas, no? Whether it be in hospitals, in communities, in businesses. A lot of people reach out and try to consult you, and you connect those dots. I want to ask you, moving forward, because we know, of course, the situation has changed a lot from where we were 6 months ago. Are there certain areas of our response that you think should be prioritized going forward?
And I just would like to frame my answer in the perspective of emergency and how it relates with that of disaster and how we are, because this is really is a pandemic is a case wherein we have to really define the connection if we are in the emergency part, since because we are still responding to it, or we are already overwhelmed. So therefore, we are already entering the disaster phase because the interventions are different. But moving forward, we have to have future-proof interventions. So we have to be proactive before it becomes a disaster. And even during the disaster, we have to also understand that we have to prepare for the next disaster, which may compound the problem of COVID. So putting that frame in mind, that this event of a COVID is this is just an event which may test the capacity of our healthcare system. So we are in an emergency response, borderlining probably a disaster, because we have to also see behind us what our resources are and if we are still capable to respond. So we have to understand that there are different different levels of measuring what a capability is of a healthcare system. So that's why we have indicators. Say, for example, dedicated beds for COVID, isolation beds for COVID, intensive care unit beds dedicated for COVID, even the number of mechanical ventilators. But there are many other indicators out there. And even until now, we're still discussing what other indicators may need to be measured to really say that these are trigger points or red flags that we can say that we are beyond capacity. So moving forward, we have to make sure that we are future-proof as to these indicators and look also into the other parts of the system. Although this is very technical, but I apologize. But I think this is very important that we have to be one in looking at these indicators. So currently, that's one aspect that we need to look into. The second one is really utilization of data and making use of that data as information, as validated information for decision making. So I think it was emphasized that the HTAC should be institutionalized, being the structure that has the capacity to screen these evidences, and it is a government structure and it is a regulatory structure that may advise us as to our response. Capacity, or competence in the sense of our health human resource, as to are they trained enough, like we are really advocating for integration now of, although there's already integration of disaster management in, or disaster risk reduction management in the basic and secondary curricula, but there's none specific for these things in our undergraduate and postgraduate courses. So these are specific specialties that also just come into play after being specialized. So there's really not much institutionalization of these curricula into our educational system. So if I may ask you, even Sophia, have you had training for emergencies when you had your secondary education, or even your baccalaureate degree perhaps, or even in your master? So we have to integrate all of these things early on in our educational system moving forward, and this should be also normative. We have to make sure that our families are prepared. We have to make sure that our families are also resilient. God forbid there might be another pandemic of this magnitude.
Well, for me, no, we've been already experiencing the pandemic for 6 months right now. So I think we should learn from our mistakes. And that's what Dr. Pauline has said. We have to use evidence based medicine at this time. So it's not because something is available in the market, then we need to use it. We have to validate if it is something that we can use and if it will benefit the majority. So there are a lot of tests, for example, that are available in the market, being promoted in Facebook that people buy, and you see people, posting that they've had this test done, but actually not because they've been approved by the FDA, then it should be also, it has to be adopted by the society. I mean, that's where the Health Technology Assessment Council, or the HTAC, comes in. So they will be the ones to decide. So we need this group of experts. And then another thing that is lacking, for example, in this response, are basic services that I hope can be given importance later, no, as time goes on. Like, for example, going inside the malls. When you go there, your temperature is checked, but every store that you go to, you have to log in your name, your address, phone number, and then your temperature. I think it's possible for us to have, like, for example, maybe a QR code, so that each of us, when we log in, and then it goes into the system, and then they can determine where you are, at what date, at what time, and then if a person becomes positive, and they can track who these close contacts are. And it's also very, like, for the businesses, we want the businesses to return, no? Pero how will you go inside the stores when, if you go to the mall, each store that you go to, you have to log in and sign in, but you're inside the mall already, so what's the point? So I hope there are just some areas where you can maybe scan something, and then the system will know that you are there, and they are able to determine who are you, or who were you in contact with at that time. So those are, maybe people think, very simple things, but it really needs cooperation from everyone, and of course budget from the government, so that we are able to enforce them.
Great. Dr. Lee?
Yes, in fact, thanks, Doc Ting Dong, for pointing out those signatures you need to come into us. Those are deterrents, in fact. And when we had this consultation, we were surprised because DTI does not require that. It's really just the local governments trying to implement that. But our question also, we need to ask deeper, what will you do with
Mm.
those forms? In one of the malls, nilagay siya sa Tambiolo. So how can you do contact tracing in that? So we need to be more critical, more analytical also in terms of the interventions. So aside from just complying with this, we need to take into account that these actually impact the economy, right? That these are deterrents. They turn off customers from coming out. So moving that way, really HPAC's priority, as we see. All of us, we agree that opening up the economy is a big priority. And in fact, we have done a lot of work in terms of trying to align interventions regarding the safe for the workplace, for ICT integration. These talks, we cannot give all the details, but what we're seeing is there are big movements. But of course, we are talking about a lot of problems that have been there even pre-COVID, and we are quite hopeful that if we continue with this momentum, we can have we can have a happy. Well, Christmas is just around the corner, right? And a priority really when we try to open up the economy safely using driven evidence informed decision making, and of course, especially with empowering behavior coming from our people, uh, protecting themselves too, not just a public policy. Then we can actually, yes, open up the economy safely, and have a better hope in the coming months.
Mm-hmm. Right. On that note as well, no, there's a lot of uncertainty, of course, about where we might be going forward. If things are going to be under control, if cases will still be increasing. A year from now, I'm just curious, where do you think we might be? Will we still be experiencing what we're experiencing today?
Well, I'm very optimistic. I don't think so. I think we will recover from this. We will all rise from this. No, it might take time, but I think next year will be okay. But maybe not as before. So maybe we will need to wear masks, and of course, social distancing pa rin. But maybe the only message that I want to tell people is to keep washing your hands, keep wearing masks, and then social distancing. If you have symptoms, consult a doctor or isolate yourself. So dapat talaga yung information dissemination so people will know what to do. And don't worry, kaya natin to.
Right, no.
Yeah.
On that note, then, a last question I'd like to ask you to wrap this discussion up as well. And, there are a lot of, because there are a lot of Filipinos who also have grown tired, still anxious regarding what they can do, how to move around. Maybe some, picking up from what Dr. Burrower said, some advice that you can give to help Filipinos navigate the way forward, today, tomorrow, or like a year to come.
Right.
Perhaps,
Um, yeah, I think the beauty also of difficult situations is that it can bring out the best in people. And having worked for the past 6 months in trying to help out, align different responses, um, I think I've been seeing people becoming more kind to each other, become more tolerant also, open-minded. And I think in terms of addressing a very complex situation like COVID, those traits are very important in terms of coping as an individual, as a family, and as a society. The Filipinos are naturally resilient, um, and moving forward, this can keep us afloat. But at the same time, while we keep in mind those traits, we don't let our guards down. Hindi tayo magpapakampante. For example, I'll give a practical example. I'm coming from Manila and I have to visit. I had to do something, some errands in the province, and even if they're my lola or I saw my lola, I refrained myself really from being in close contact with her because I didn't know at that time. No? So those kinds of things were very hard. But because the situation is does not allow it yet, then I do it for her. So it's about those kinds of empowering behavior in you know why you're doing this and you're not letting your guards down at this point in the pandemic, because this is not going to be the same. It's not going to be the same, say next month and the next month. Even our recommendation for relaxing the physical distancing, it's because of the situation. That's why we are recommending not yet. It's not yet time. So there again, it's about timing. It's about empowering behavior at the right time, the right interventions at the right time, and for families, how to cope with it is to be prepared. Let's be realistic. For me, I'm an optimist. Really, I'm really an optimist. But at this point, it helps also to look at the worst case scenario, so that if you know the worst case scenario, then you will not panic when it comes, and you can prepare before it comes, even if it's just about knowing which number to call if somebody needs help. So you don't necessarily rush to the hospital, or who do I get in touch with if this happens to me in the workplace, things like that, very practical things that each person, each family can prepare for in terms of coping moving forward. Thank you.
And on that note, I think regardless of, let's say, whether cases are low or high, no matter the numbers that we're seeing per day, the same advice still holds, as I understand. Keep wearing your mask, wash your hands, make sure that you practice good cough etiquette and everything, because those are some things that will really help carry us through, at least for the foreseeable future, no? Hanggang wala pang vaccine.
As I mentioned, the open air activities, parks, eventually, they can be safe places where physical distancing can happen. And you add open air wherein the virus cannot be easily transmitted. Those things, we hope that the local governments can support these efforts, as we call for them in the coming months as we open up, so that people will not be forced to be in confined spaces wherein transmission is high. If you can look at your workplaces, if you can improve the ventilation, if you can hold activities outside, or if you can allow your workers to work from home, all of these are practical interventions that don't put people at risk. So we hope that things can be explored so that we can continue moving together forward. Not really trying to yeah, people might be pitting some people against each other, but no, we have the same goal, and these interventions are safe, are proven, and we can optimize those. Thank you.
Right, right. So, a lot of things that we can do to move forward, no, and definitely we're not helpless, and there are solutions that we can institute, and of course, a lot of people that local governments, officials, businesses can tap. That people like you in HPAC. And on that note, thank you so much for joining us today. We really appreciate you having us here to discuss all these issues and to help give perspective and advice on what Filipinos can do moving forward, let's say to the end of the month, to the end of the year, even. And on that note, we really look forward to having you back with us again soon. Thank you, and join us again next time.
Thank you.
Thank you.